Welcome to this month's Fit for Colorado Talk to the Doc Chat. I'm CBS4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be talking about fitness and health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss stroke. A stroke is described as a brain attack. Most occur when an artery or blood vessel to the brain is either blocked by a blood clot or ruptures, cutting off blood flow and oxygen to the brain. Stroke is the third leading cause of death in America, killing 160,000 people each year. It is the #1 cause of adult disability. 2/3 of all strokes happen in people over the age of 65, although they can happen to anybody. The good news, up to 80% of strokes are preventable. Joining me today is Dr. Chris Fanal, stroke neurologist and medical director of the stroke program at Swedish Medical Center, and Kim Gorman, registered dietitian and weight management program director of the Center for Human Nutrition, UC Denver. Dr. Fanal, let's start with you. We've got a list of symptoms of stroke. Let's go down that list, if you will. They all seem to be sudden, the way they come on, and the first one would be sudden numbness or weakness in the face, arm, and leg, correct?
That is correct. And that is usually due to where that clot is in the brain, or where that rupture of that artery is in the brain, and that will cause either numbness or weakness or the leg. And like you said, the sudden nature is what distinguishes it from any other disease.
Sure, and the next one I've read about is sudden confusion, trouble speaking. We've all heard of that.
That's correct. And again, many people come into the hospital for confusion, problem speaking, but it is, again, the sudden nature of that and what we call an aphasia, an actual language deficit, where people may be trying to say certain words, but they fumble over them or are saying the wrong words or word substitutions, in addition to slurred speech.
Another symptom, sudden trouble seeing.
And that is, again, due to the area that the clot is occurring, and that is mostly due to a clot in the visual cortex, or the areas where the clot is causing processing of vision problems. And so that's why they would see it as problems seeing things.
All right. Sudden trouble walking, dizziness.
And again, this is in the balance area of the brain called the cerebellum, or also another area called the brain stem, where they will have problems with walking because of coordination or dizziness. And again, that sudden nature is the big thing.
And then this last one that I've seen is sudden severe headache.
And this is a very, very important one that may help us distinguish if it is due to a clot to the brain versus a blood vessel bursting. Often the blood vessel bursting will cause the sudden severe headache that we see often.
So what damage can a stroke do?
Well, the damage that a stroke causes is due to the lack of oxygen and blood flow to that area of the brain. And so you will have cell death from that, and neurons and brain tissues are very exquisitely sensitive to not having enough oxygen. And so because of that, if you have lack of blood flow even for seconds, it can cause severe and irreparable damage at times.
So risk factors, we always talk about these things. Kim knows that, and every time we seem to go back to sometimes exercise and obesity. But let's start with the ones that are beyond your control. Over age 55 is one I've seen. Male is the next one. African American, have diabetes, and a family history. Do those all make sense? Those are the ones that you really can't control?
Right. Unfortunately, we can't control our age, we can't control our sex or our ethnicity, and it is just unfortunate that as we age, of course, it's more time that our blood vessels have to be damaged from the activities of daily living, high blood pressure, all those things. Even with the best nutrition, as we age, unfortunately, so do our vessels. The issues of ethnicity, this has been a very curious thing, multiple factors, but for some reason African Americans do have a higher risk of hypertension, as well as risk, therefore, of heart disease, as well as stroke.
All right, and Kim, I saw diabetes on there, and while sometimes you can prevent that, sometimes you can't. What would you tell somebody about trying to prevent diabetes?
You know, what we can do, once diabetes is there, it's there, but we can work on the symptoms that are there and help modify diet and physical activity to help the body do its best to regulate blood sugar. In addition, if you need if you need agents, you need medication to take care of it, certainly you want to get all the blood sugar managed.
And that's one of the things you have to be on top of all the time, though, don't you?
You got to stay on top of it. Again, with good results, good health comes consistency and persistency and good information. So without a doubt, it's true with diabetes as well.
Let's look at medical risk factors for stroke, doctor. One I've seen, first of all, is previous stroke or mini stroke. So does that mean if you've had one, you probably will have another?
Well, it's a warning sign, especially the mini stroke. Many people will have symptoms of stroke, such as those things that we talked about, problems talking, vision changes, or weakness, and it may last for 5 to 10 minutes, and people shake it off, so to speak, and go to bed. And unfortunately, that is a warning sign, and that may be due to a narrowing of an artery that if we can pick it up early, we can intervene early, and they will have no further risk factors or won't have that same risk. But unfortunately, once people do have a stroke, those underlying factors are there, and now their body has told us that they will likely have another stroke. So we need to do everything we can to aggressively intervene in that. That's medication, but mostly, and a relatively inexpensive thing, is lifestyle modification, increasing and improving your nutrition.
Yeah, I think these next few go part and parcel with that. High cholesterol is another medical stroke risk factor, as well as high blood pressure. And those are things that you can work to control, correct, Kim?
Absolutely. You know, when we talk about blood pressure, that's probably the most important modifiable risk factor that we have in terms of stroke. And so we look at it from a dietitian standpoint, we're looking at sodium in the diet as well as potassium. If we can get those changed a little bit, meaning if we can decrease the sodium a little bit, we can lift the potassium a little bit, there's some good evidence to support that we can decrease blood pressure in those that do not have essential high blood pressure, those that can actually affect their blood pressure with their diet.
Is that one of the things you talk to patients about a lot?
All the time. And those patients who have the highest amount of risk factors, I usually do try to refer to a nutrition so they can go over specifically the things that they should avoid to eat. People will, of course, I feel, are much more afraid of a stroke than of a heart attack. Heart attack is something real that they can see. They know that there are many things that can be done, but stroke is a disabling phenomenon, and that is the thing that people are most worried about, is their quality of life afterwards. And so this I see as an opportunity to educate those people, especially when they come in with either a small stroke or a mini stroke or a TIA, transient ischemic attack, and that's the time to intervene, to really be aggressive. If they are overweight, if they are smoking and their blood pressure is out of control, that's the time to intervene.
Yeah, it's interesting you were talking about heart attack. The last medical risk factor that I've seen is heart disease or carotid artery disease, so they go hand in hand, don't they?
Absolutely. It's the same process of atherosclerosis. The hypertension, the high cholesterol affects the heart vessels as well as all the vessels throughout our body. And of course, we may not be able to detect the large vessel things like the aorta. However, smaller vessels that go to the heart as well as in the brain, the same process is happening on a daily level. And the carotid artery, of course, is the largest vessel that goes to the brain, and unfortunately is one of the vessels that gets diseased quickly with these same risk factors and can cause stroke.
Sure. Now let's take a look at the lifestyle risk factors. The very first one, smoking. And I read somewhere where it says it quadruples the risk of stroke if you smoke.
Absolutely. This is, to me, we can work on hypertension, we can work on our diet, but the one thing that you can intervene, I feel, the most on is smoking. I understand people say this is the one thing I do for comfort. However, there are just so many things we can now do. There are hotlines that you can call, there are medications you can take, patches, gums, all of those things. It really just takes the will, and unfortunately, it is still a rampant problem. It is amazing to me, as healthy of a population that Colorado is. I see 20, 30-year-olds who are still smoking a pack and a half a day, and yet on the other end they're mountain biking and they feel that they're healthy. And I tell them that is a major issue. You can do all of those things to stay healthy, but that smoking will get to you.
It is amazing. We were just talking about being around smokers too,
Yes.
how much it bothers you. You were just in Las Vegas, and you get nauseous almost, don't you?
It was packed full of smoke. You know, I was wondering, just as we're thinking about someone who's young and vibrant and thinking, I am healthy, it'd be phenomenal to be able to put somebody in a simulator of what it would be like to have had a stroke. I mean, can you imagine how motivating that potentially could be to somebody if it's that, you know, risk factor in particular, trying to get them to have some awareness on what it means?
If you know someone or have been close to someone who's had a stroke.
Right, and I think that's when it's very, very powerful. Is I have family members who come in, sons and daughters, and say, wow, this is real. This is something that can happen to someone in my family. And they become great advocates for stroke prevention. And the time to truly intervene is what we call primary prevention, before you even have the first stroke. And of course, that's what we all are after.
Let's look at a couple of these other lifestyle risk factors. In addition to smoking, being overweight and too much alcohol. I feel like, Kim, every time we do a Talk to the Doc, we talk about these problems. Being overweight, too much alcohol, smoking, not exercising. What do you tell people? You know,
it's frustrating, I guess, to get the word out to where it's received well. It's not a sentence, it's an opportunity. It's a chance to take good information and make a small change in your lifestyle. We talked about the heart disease. We're looking at a low-fat diet, high-fiber diet, lots of fruits and vegetables. It's nothing that is new. It's how do you get people to do it? And so one of the things I think to streamline or simplify it to get people started is to ask for one behavior change. What's one thing you're willing to do, either on the diet end or the physical activity end, that you're willing to do on a daily basis? Just one. Let's get that one part of a diet or part of our lifestyle consistently, and then we'll look at the second one.
And do you find that if you can get somebody to get over that first one, that the second one might be a little easier and the third one might be a little easier?
It's realizing that you can do it. Again, I guess when folks look at smoking, all of my parents smoked, and at this point, knock on wood, they have stopped smoking, but it's very trying and very challenging because they're going, and then you kind of stop doing it. And I think with food, you have opportunities all day long to make choices, so it's not an all or nothing. You still have to make good choices. So I think if you can start empowering yourself to say, I can do one. I can add a piece of fruit to breakfast every single morning. That I can do. I can check it off the list. I know I did it. Then you look at the physical activity. Can I do 5 minutes of physical activity? It's not about, when you're starting, it's not about walking 30 minutes a day off the get-go. It's about getting through the process, the behavior. Do I have shoes that are going to comfort my feet so that I can walk? So it's breaking it down and being able to break it down so that it's attainable, and that starts building the confidence.
Yeah. Let's take a couple of questions that we've gotten now. William asks, is obesity a risk factor for stroke? Well, we see that for sure. Right?
Absolutely.
Here's another one. Peasley1 asks, is having a history of TIAs a predictor of a future stroke? Can you explain TIAs again so people understand?
Sure. Well, TIA is a transient ischemic attack. And so what that is a blood clot goes to the brain, occludes or closes off a vessel, and luckily the body is able to break that up and bust the clot, so to speak, on its own. And we think that may be due to because it's a small clot or a very soft clot the body is able to handle. And absolutely, it is a warning sign that you are going to have another stroke. It is really the